Millard Fillmore Gates started out as a homeopathic hospital in the 1800s, and over time transitioned to a hospital where they accepted credentialed physicians who had MDs. But probably the most interesting point about Millard Fillmore Gates is it was named after our 13th president, Millard Fillmore. He was born in Western New York and actually died in Buffalo. And ironically, he died in Buffalo of a stroke. And what we know Gates today to be is the comprehensive stroke center for our region, as well as one of the best in the country and soon to be the world. You know, ironically, most people know me as the president of Gates Hospital, but I started at Millard Gates as a new nurse 35 years ago. I have very fond memories. That's where I grew up. It was a family-oriented, physicians, nurses, residents, and all of our allied health professionals helping one and each other to grow, caring for our patients. And I had the privilege and the honor to come back 20 years later, not until 1998, to become president of the Millard Fillmore Gates Hospital. So I have very fond memories. I grew up there in my career, and many of the physicians and nurses there that work there today are those that helped shape who I am today as both a value-based clinician as well as a value-based leader.
Just proud of this place. This was the hospital to be in if you were sick. Or where do you work? Gates? You work at Gates? It was really something. I was proud. I'm still proud. That's why I'm here after next year it'd be 40 years.
Well, when I first started, it was July the 29th, 1970, and this was my home away from home. I raised my kids up through Millard, and we were all family. We stuck together, we did everything together. It was just fun.
The first pacemaker was inserted here, I believe, in 1963, and the first coronary angiography in Buffalo was done by Dr. Jimanovic, who trained at Gates Circle and then went on to Cleveland Clinic, where many of our cardiologists were trained. We had the first CT scanner in Western New York. I believe that the Dent Institute's CT scanner was the third in the country at that time. I have to say that I met my wife here at Gates Circle, and so I really owe a great deal of gratitude to this facility beyond my professional careers. For my personal happiness.
This was an unsolicited gift which someone brought. This is from HCI, showing that Millard Fillmore Gates Hospital was one of the top 100 hospitals in coronary bypass surgery. This is not an achievement by one particular surgeon or a group of surgeons. This is an achievement by collaborative efforts and a teamwork of everyone working together. Although I'm sad that this hospital is going to close, but I'm very happy and excited that all our people who help us every day here, all our nurses and people around us who have made this place a success will move with us to the new building next to Buffalo General Hospital.
Over the past 31 years, Millard Fillmore Gates Hospital has been my home away from home, and the staff here has been my extended family, and it's been that family, that teamwork, that's been the inspiration to me and my partners.
My memories of this hospital are great. Whenever I'll think of Millard Fillmore Gates Hospital, I'll think of patient care, compassion, excellence, collegiality, and shooting for the stars.
Everyone here in the cath lab and is affiliated with the cath lab, the CIU, the CMU, everyone really wants to make a difference. They're really doing it. I think that's something that's really propelled this hospital over the decades, and I hope it's something that, and I really expect it will be something this culture will kind of carry on when we move to the new GHVI.
I think the legacy of Millard Fillmore Gates is a culture of caring. They say it over and over that, you know, it's a special place, and it really is. It's truly a family where we take ownership of the hospital and the patients and everything that we do here. We strive for positive outcomes for our patients as well as having a really nice environment to work in. I'm gonna miss Gates, really, really miss Gates.
We never thought when we began working with the Millard Gates Hospital to form the Hand Center that we would still be here 25 years later. I think the fact that we've been here for that number of years and have grown throughout that time is a testament to the primary focus, which is and always has been at the Millard Gates, which is patient care first. From the moment you walk into the hospital and are greeted by the volunteer, to the people that say hello to you in the hallways, to the nurses who help you and work overtime to make cases finish, to the physicians, the entire focus of the hospital has been patient care first and making every patient's care here as positive experience as can be, understanding the circumstances. The goal at Millard Gates has been to treat patients like family and work together as a family. It's been a privilege to be part of this community for the last 25 years, knowing that we've made such a positive impact on so many patients.
Oh, I've been here 43 years. 43 wonderful years. We were like family. We still like family.
As most people know, Millard Fillmore Gates has become one of the premier stroke centers in the world. The doctors here lecture both on a national stage and an international stage, and this has been an evolution over the past decade. We were one of the first centers in the country to perform stroke intervention, meaning going up with small catheters and small devices and actually pulling clot or trapping clot out of the brain in order to rescue patients from the devastation of stroke. For Buffalo, the legacy of Gates, at least in the era when I've been practicing here, will be one of being a preeminent stroke center. It was one of the first hospitals to employ telemedicine, linking the rural communities of Western New York to Buffalo, linking the patients that didn't have access to tertiary medical care and high-end neurosurgical care, linking them right here to the Millard. So even patients as far as 3 hours away were able to get the benefit of being treated by doctors here at the Millard via telemedicine. So the legacy is one that put Buffalo on the map as being the leading stroke center, not only in the United States, but in the world.
In 1979, which is a bunch of years ago, I joined Nick Hopkins in the Department of Neurosurgery here, and over the years we've built it into one of the leading neurosurgical residencies in the country, mostly centered around vascular neurosurgery. Over the years we've added a great number of partners to our group, and now it's a multi-specialty, high-speed residency. We worked very closely with the Dent Neurologic Institute, and they are still good partners in clinical medicine. More so than the clinical program, the Millard for me has been a second home and a second family. It's a position, it's a place where you can prove that you can truly deliver quality medical care, top-notch medical care, with good people and have a good time doing it. I think more than anything, the best legacy this hospital has are the tens of thousands of patients that have been treated here, and the camaraderie and the friendship and the relationships that have developed over 31 years. It will be hard to replace.
We actually evolved over a period of about 25 years, a stroke team which today is it's composed of many docs in the emergency room, the neurologists. There are 4 of us in the Department of Neurosurgery that focus on treating strokes. We treat strokes 24/7, 365. I saw a patient in the office this morning who was in her early 60s, who came in with a major stroke, was completely paralyzed, couldn't talk, was totally non-functional, headed for a nursing home earlier this year, and we were able to, with a catheter, go up and place a little tiny stent, open up that artery, and it was like watching a flower bloom in the spring. Over a period of minutes, she began moving and then talking, and about 2 days later she walked out of the hospital, and today she is completely normal.
Well, I think both Gates and the Global Vascular Institute will be exceptional in that we provide comprehensive stroke care. And I could go through and list all the things that we do, but in summary, from the moment you walk in the door until the moment you finish rehabilitation, we've taken care of you the whole way.
I just want to say thank you for the memories and to everybody that I've met along the way.
I was at Millard in September of 2006, and right after that was the announcement about the Berger Commission report, which represented significant change for the organization and for the team at Gates. And for me, it was a great opportunity to be able to engage with the staff and the physicians around a period of great transition. And it was exciting. And the team deserves a tremendous amount of credit for taking something that could be perceived as upsetting and disturbing and seized it and ran with it to create one of the greatest changes that you're going to see in Western New York healthcare, which is the creation of the Vascular Institute. And so for me personally, that was just very exciting, very rewarding, and is a testament to what the team at Millard has done for many, many years for this community.
The Gates Circle facility gave myself and my colleagues and a very dedicated and committed management team working with a tremendously high-quality medical staff, nursing staff, and support staff, and supportive board in achieving many accomplishments for Buffalo and Western New York at the Gates Circle facility. More importantly, it's a celebration of the spirit that each of us carries with us in healthcare, in making caring a way of life, as it was at Gates Circle during my tenure.
I started in the year of 1960. I worked as a nurse's aide first. Then I went into pulmonary function. Then I came here, and I've been down in the pharmacy for more than 40 years.
The Berger Commission back in 2006 was looking to reform healthcare, and one of its goals was to take capacity out of the system. And when you look at the Western New York healthcare market, we did need to shrink, we did need to reform, we did need to change. So what the Berger Commission allowed us to do is to embrace the commission, embrace the opportunity for change, and create something new. So we're taking what we have, which is very good, and making it better. And within my last 7 years, I think the greatest accomplishment is that team has held together an organization to serve the community at a time of very significant change. That's a tribute to the people at Gates, how wonderful they are and how committed they are.
When I took the assignment, I never thought of the hospital ever ending. I thought this program or this hospital really has outstanding services and outstanding programs, and I've always thought of it as just moving the program. But now, having been here for a while, it's really an honor and a pleasure to really lead this fine institution into its new future. But the closing of Gates is really, in some ways it's sad, but in some ways, knowing the vibrant programs that we have, it's a very happy time. It's not unlike just moving out of a house that you've lived in for a long period of time, where you have wonderful memories, wonderful things have happened here, but looking forward to a real bright future in a brand new facility. Millard Fillmore Gates Hospital has been through a lot of change in its 100-year history. Throughout all this change, it's really been its people, the physicians, the staff, the nurses, the patients and their families that have been the life force of this institution. So even though the physical entity and the structure of Gates Circle Hospital as we know it will soon be ending, its legacy will live on and grow into the future.